Hello, my name is Dr. Stanley Lang. Welcome to this broadcast, and the subject is how to raise low HDL. HDL stands for high density lipoprotein, which is also known as the so-called good cholesterol. As I've mentioned before, I'm also known as the whole health doc because my approach to medical care has been to provide a whole person health approach that's health of body, mind, and spirit. And today I'd like to focus on more of the physical part of that. But I'm going to touch on this integrated holistic approach also for a moment. The reason that we focus a lot on HDL is because we want to avoid heart disease, particularly coronary artery disease. So there's a lot of different kinds of heart disease, but the main one, the main killer and cause of disease in our society is coronary artery disease, which means that the arteries that feed the heart oxygen are blocked partially or completely. And so what's the connection with the low HDL? And the connection is that HDL is, in its role as the so-called good cholesterol, one of its jobs is to help keep the arteries clean. So when your HDL is low, that has been understood as a risk factor for developing coronary artery disease. And so this conclusion that HDL is a risk factor for coronary artery disease goes back now decades, and it's actually one of the most consistent and well-researched conclusions that we have in medicine. In fact, the HDL is much more important than the cholesterol that most doctors are paying attention to, which is the LDL, or so-called bad cholesterol. And it's the ratio of HDL to triglycerides, another fat that we measure when we check a cholesterol profile. It's that ratio that is the most significant marker of what your risk for a heart disease is when you're looking at just the cholesterol. Now, there are other significant markers to pay attention to, but today we're just focusing on HDL cholesterol. And when it's low, the ratio between HDL and triglycerides is not favorable in most people. And in this case, the patient that I was seeing today, that was the case. In fact, his triglycerides weren't that bad, but his HDL was quite bad. And this is something that I've been seeing, of course, my whole medical career. And in the early years, I basically knew what I'd been taught in medical school and residency, which was that you can't really raise the HDL very well. That's what the prevailing wisdom was at that time. And since then, I've learned that you can dramatically increase the HDL if you know what to do, which is what I'd like to share with you today. So the conventional wisdom, back when I was in training, and it still is today, is that there's not too many ways to raise the HDL. One is to do vigorous exercise, aerobic exercise. The second is that there's some foods, particularly chemicals that are in vegetables and fruit, that can raise the HDL a little bit. And wine has always been identified as having more of these particular phytochemicals than many other foods. And so it's been something that's talked about. And then there were some medicines that would raise the HDL a little bit. Niacin, which is in a high amount, which is a vitamin, when given in large amounts, can raise the HDL a little bit. And then statins are common drugs that are given to lots and lots of people, and that can raise the HDL a little bit. Although a lot of times it drops all of the cholesterol so far, the HDL actually goes down, but the relative ratio might be actually more favorable once it's all calculated. So these drugs are the ways that typically doctors approach trying to raise the HDL, which the idea is to improve the person's odds that they're not going to have a heart attack, or they're not going to have another heart attack if they've already had one. So what I've discovered is that HDL, and I'm not alone in this discovery, there's a lot of doctors that know this, but what I discovered now about 3 decades ago was that low HDL almost always was not because of genetics, which is what I was taught, but it's because of lifestyle choices that cause a suppression of HDL by the high insulin levels that are part of what we call insulin resistance syndrome or metabolic syndrome. Now, this is something that's very common. Over 50% of people or adults in the United States now have metabolic syndrome. So these folks are walking around with sort of a ticking time bomb ready to go off that's basically causing their arteries to be under a lot of increased inflammation. And the HDL being suppressed is only one thing that's going on that is part of that picture. So the approach that I have evolved to is to address the underlying biochemical reason for why HDL is low in the first place. And the reason it's low is because people have been eating high glycemic foods over and over again. What are high glycemic foods? These are foods that raise the blood sugar very quickly, such as grains, potatoes, rice, and sugar. So you might recognize in that list some foods that you eat on a regular basis. And if you do, then it's probably pushing you into insulin resistance or metabolic syndrome. Now, in the grains, the common foods in the United States are breads, pastas, crackers, cereal, and pretzels. So again, these are foods that are promoted a lot. They're eaten a lot. They're eaten for meals, eaten for snacks. And so when I teach people how to correct this HDL issue, I teach them two things. One is a low glycemic diet, and the second is to use safe fish oil, safe fish oil. So talk a little bit about both of those. Low glycemic diet basically means that you're going to eat in a way that doesn't spike the blood sugar. Now, you have two different basic options to do that. The first is that you're still going to depend on sugar for fuel, but you're going to only eat carbs that raise the blood sugar slowly. So that means that you're going to eat mainly vegetables and some fruits as part of as the carbs. Now, that does not mean a low carb diet. That's mistakenly called a low carb diet lots of times because people think carbs are grains, potatoes, rice, and sugar. And that's only the high glycemic carbs. So this is not a low carb diet. It's a low glycemic diet. So a low glycemic diet means that you're eating mainly carbs for fuel from fruits and vegetables, but the blood sugar rises very slowly right after that meal. Now, the person is still eating significant amounts of protein and fat from healthy sources with this strategy. I've been teaching this strategy for more than 30 years. It works wonderfully to correct this problem. And at the same time, there's a lot of benefits like tremendous weight loss that goes down, blood pressure drops. And if the person's diabetic, there's a good chance that they will reverse their diabetes or at least control it better if they follow this. Now, the second part of this is what we call safe fish oil. Now, why do I say safe fish oil? Well, the reason I say that is because most fish oil is contaminated with heavy metals. This has been researched in the past. It's still true. The situation hasn't improved any. It's just kind of being ignored by most people. So typically what happens is that when people decide to start supplementing with fish oil, they go down to the nearest store that sells the cheapest nutritional supplements and buy the cheapest thing that they can find. And what they get is cheap. So in many cases, the oil has been damaged because of the extraction process. And in most cases, not many, but most cases, it has heavy metal contamination. And there's only one way that it's not going to have heavy metal contamination, and that's if the company that's selling it has specifically scrubbed that oil clean of the heavy metals. And if it doesn't go through that process of cleaning the oil of heavy metals, it's going to be contaminated. Why? Because the fish that this oil is extracted from is contaminated. So if your source of fish oil doesn't have this process where they guarantee that they have cleaned the oil well, if it doesn't do that, I can guarantee you that it's contaminated with heavy metals. So then you're in this quandary. Am I going to take a lot of fish oil to be able to help my HDL to go up and the other benefits that fish oil might have? Or am I going to sort of ignore that so that I don't have more exposure to heavy metals, which you already have quite a bit anyway? So here's the sequence. It's critical to be on a low glycemic diet for several months before you'll even see much of a bump in the HDL. In other words, the body won't start to raise the HDL up until a person has reversed their insulin resistance for several months. It's kind of like a brake has been put on the system in the liver it's going to not make HDL until the person has been doing two things. Number one is that they have been on this low glycemic diet very consistently. And number two, they're eating or taking safe fish oil. Safe fish oil. That means fish oil that has, it's clean. It's coming from as clean a sources as possible. And they're taking enough of it. So how much is enough? You need 2 grams of the omega-3 portion of fish oil. So fish oil is not just omega-3, but it's a good source of some omega-3s, and those are called DHA and EPA. Those are the abbreviations for it. And together, the DHA and EPA that you're taking when you're using this strategy to try to raise your HDL needs to add up to about 2 grams of this omega-3 per day. So how many capsules you're taking is dependent on what the percentage of the oil is omega-3. In some cases, it's as low as 30% of the capsule, and in some cases, it's as high as 60%. So you might have to be taking 4 capsules a day, or you might need to be taking 6 capsules a day, or even more, depending on the percentage that's in the fish oil that you're taking. Now, when you do both of these things, after about 6 to 9 months, you'll start to see the HDL rise. And I've seen people double their HDL levels just by doing this, double their HDL levels just by doing this. So if you think that you can only raise your HDL levels a little bit, you've been misinformed. And if you think that the only way you can do it is to take a statin drug, you've definitely been misinformed. Now, I also mentioned that there's a second way, or at least I inferred that there's another way to eat low glycemic, and that's the ketogenic diet. So the ketogenic diet is not depending on glucose for fuel. It does have a small amount of vegetables in it, but most of the fuel is coming from fat. So it's about a 70% or more fat diet as far as calories. About 20% or approximately is protein, and the rest is vegetables or less. It might be 5 to 10%. Depends on how old you are. The younger you are, the less carbs you can have and stay in ketosis. The older you are, there's more flexibility. But the ketogenic diet, in combination with, say, fish oil, is going to be a very powerful way to raise the HDL also. In fact, it raises it even more. So people on the ketogenic diet, when they're getting enough of the fish oil, will have a significant rise in their HDL, because they're not getting any of that significant signal that's pushing the body into insulin resistance, because they're basically consuming very small amounts of carbs. So insulin resistance goes away, and so the person benefits then from this combination of very low glycemic eating and the essential fat, not the essential fat, the omega-3 fat supplementation. Now, I want to point out that this source of omega-3, these are not the essential fats that we also need. So the essential omega-3 fat is called alpha-linoleic acid. It's abbreviated ALA. This is not ALA. You still need that. It's a critical part of your nutrient needs, and that's a whole different topic. But if you want to raise, in summary, if you want to raise your HDL naturally, the two most critical things are low glycemic eating and eating enough of the essential fats. Now, how to do this properly is only a small part of that course that you can tap into and be part of completely free. The online academy, the link is below this video if you're interested. If you just want to go on your merry way and use what I've told you, then do that too. But there's a lot more to this if you want that lot more help. Because the whole idea here is that these aren't the only things that are the risk factors for heart disease. In fact, a little known fact is that stress is one of the major factors for heart disease. And in some ways, you could say that stress is the major factor for heart disease, because in societies where everybody is doing everything wrong, but they have low stress, heart disease is almost unknown. So just leave that as a parting thought. If you want to do everything you can to lower your risk for heart disease, there's a lot of things that are related to eliminating or moderating the effect of stress on your body. And that's part of that online program that you can have complete free access to for 7 days, which I encourage you to take advantage of. A pretty good deal for 7 days. So hope you found this helpful. God bless and have a great day.